So welcome everybody. Welcome to PCC4U's webinar. It's our second one for the year and the month has gone around really fast for us to come back to another webinar, but we're really glad that you could find us and could join us today. Before we get started though, we'd like to do an acknowledgement to country. So thank you, Sharon.
QUT acknowledges the First Nations owners of the lands on where we gather today and pay our respects to the elders, laws, customs and creation spirits of this country. For thousands of years, the First Nations owners have gathered to share their knowledge and stories. We pay our respects to all Aboriginal and Torres Strait Islander peoples and acknowledge the important role they play within our communities. We recognise their long and continuing connection to country, the lands, winds and waters throughout Australia. We recognise that these lands have always been places of teaching, researching and learning.
Thank you. We're very proud to be joining you today from Turrbal and Yagara country here in Meanjin, Brisbane. And if you'd like to share in the chat where you're joining us from today, if you haven't already, we'd love to see where you're coming from today, as well as the RTO that you might be joining us from as well, if you haven't already popped that in. While you're doing that, I'd like to introduce myself. My name's Karen Wynn. I'm one of the PCC4U Learning and Development Coordinators. Alongside me today will be my fellow PCC4U Learning and Development Coordinator, Sharon Wetz, and also joining us is the delightful Kylie Ash, who's our National Project Manager. So welcome everybody. So what are we talking about today? Today we're going to be having a look at some RTO resources. We'll be looking at 4 different courses that we have available for you, for yourself and for your students. I'll be talking about 2 and Sharon will be talking about 2 as well, so you don't get too sick of my voice as the tour goes on. So what I'll do now is I'm going to show you, we're going to talk about the EN Toolkit version 3. Now this was released last year. For those who are new to our site, we're going to go through it just briefly, show you some of the key points about the toolkit and how it may be of benefit to you and your students. So I'll just share my screen and I'm going to go into, you'll find our toolkit on the PCC4U LMS, which is easy to register into. Once you're registered, you have access to all of our resources, one of them being the EN Toolkit version 3. So this toolkit, it's mapped to each element of the HLTENN068 performance criteria. It's also mapped to the knowledge evidence for HL10068 and along with the NMBA standards for practice for enrolled nurses 2016. I'll just scroll down. As you can see, we have 6 topics, and these are 6 stories or human stories that align to each of the 6 topics that are part of our EN Toolkit. So hopefully everyone can see that. So as I said, 6 topics, those are beginning with the principles of palliative care. So it's a journey right through for students which aligns to all the principles that are important for the palliative care journey of the patient. Discusses communication with people with life-limiting illness, which is one of our most popular topics because of the difficulties that are associated with that. We look at symptom assessment and management of pain, and optimizing function in palliative care, and also we look at end-of-life care. What we'll do now is I'll stop sharing and Sharon will show us a short video which puts it together, those 6 topics all together, so you can have a quick look at the value that this product has.
Designing a course to meet the requirements of a unit of competency is challenging. Imagine a solution that's free, developed and maintained by subject matter experts, has ongoing implementation support based on contemporary evidence and mapped for you. For the unit of competency, provide end-of-life care and a palliative approach in nursing practice, Release 2, the hard work is done. Introducing the PCC4U Enrolled Nurse Toolkit, an online palliative care resource designed specifically for the vocational education and training sector. The PCC4U solution is a bespoke learning and teaching resource reflecting Australian standards and work practices. Encouraging active learning, the Enrolled Nurse Toolkit is designed to ensure work-ready graduates. Our resources can be easily adapted and contextualised to fit your student cohort, location or organisation, and are designed for face-to-face, online or blended learning. Contact the PCC for You team to start implementing the Enrolled Nurse Toolkit today.
Sharon. And a little later, you can ask, we can have some questions around how we can share some of our SCORM packages with your universities, or your RTOs, I should say, as well. And Kylie will be able to speak to that because she's the guru on SCORM sharing. So I've just thrown her in it. So we'll be doing that a bit later. So what I'll do now is I'll go back to our LMS and show you a little bit about the topics that are involved with our EN Toolkit. And just again, let me know if that's not sharing. That looks like it's sharing really well. So as you can see, I'll open up one of the topics. So we've got the 6 topics here that I already talked about, and they are again aligned to human stories. We'll open up topic 5. This is a story about a gentleman called Bob. And our online modules use a modality of teaching resources, which is excellent. I think it really suits all sorts of learners. So there's text, there's theory, obviously text theory, videos, interviews, and interactive activities, which will help engage the student while they're learning without realizing that they're learning. So if we get to meet Bob, as you come down here, for instance, you'll see that Bob's story is broken into 5 sessions with all the important principles of palliative care that are broken into his story. I'll open up one of them for you so you can have a little look at what it looks like from the student perspective. We go in. All right, so the students can work their way. As you can see, this is what our e-modules look like. They're really engaging, lots of great imagery, photographs, and animation. The students can work their way down through each of the lessons on the side. So for instance, reflection on loss, they'll go through, read some theory. There'll be some engaging activities. For instance, here in common experiences at the loss of end of life, the students can do an engaging activity where they can flip cards and do some of active learning as they're going through the theory as it go, of the story of Bob. Then they get to meet Bob and understand his journey. And this gentleman has motor neuron disease. So you get to meet Bob. And the remaining sessions, as I showed you, I'll just close that down. The remaining sessions, tell me if you can still see everything. Show you happy. The remaining sessions use the online modules to learn more about the goals of care for Bob, ethical and legal considerations for this gentleman, how to optimize his function, and the optimizing function for the community and carers that are supporting him as well. So you go through the whole journey with Bob, which is excellent. And as I said, it's embedding the palliative care principles within each of the lessons. So that's a little bit about what that will look like. So that's our Enrolled Nurse Toolkit. I won't deep dive into it too much, but that's gives you a little element of what it looks like and the interactivity that we have there with our students. So what we'll do now is I'll talk about the Care Worker Toolkit. So can we see, it says Care Worker Toolkit version 2. Oh, thumbs up, it's a miracle. So what we're having a look at today is the Care Worker Toolkit version 2. So a lot of work's gone into aligning this current toolkit that's just been released with the new unit of competency. So I'm sure everybody's aware with the changes that have happened there, but I'll step through some of those changes in case it's some information that you're still accessing yourselves. So our Care Worker Toolkit consists of 5 topics. Again, principles of the palliative approach, supporting care, providing care, end-of-life care strategies, and managing your own personal and emotional responses. So the content is actually mapped to each element and performance criteria of the unit of competency, and also to each item of knowledge of evidence for CH-PAL 003, for the new unit of competency. We've also done mapping, and we've embedded into our outline of how it maps to the Code of Conduct for Aged Care. Within our story, so what I'll do is I'll share with you now one of our patients our patient Ben, who is part of our Care Worker Toolkit. And what we'll do is, if you want to find the Care Worker Toolkit, I'll show you another way. Once you're in the LMS, you've sort of come back into this at another time. Oh, Care Worker. You can type into the search bar here, Toolkit, Care Worker Toolkit, and it will show you the older versions along with the newer versions. So PAL 001 is the version that you currently be teaching out, and Care Worker Toolkit version 2 is PAL 003. So if we go into here, again, you can have a little look. We have 5 topics, and they cover principles, supporting care, providing care, end-of-life care, and managing responses. So students get to meet, and I'll go into here, a patient called Ben. He's a lovely gentleman who is a gentleman and his wife Jen, who we get to go through the entire journey of Ben's story. So again, as you can see here, it's broken into sessions, and within each of these sessions, the students are starting to learn more and more about the palliative approach to care. So they get to understand the complexities of the palliative care journey for both Ben and his wife Jen. So I'll come into one and have a little look. It uses, again, a number of modalities to teach the theory. So we have videos, interviews, text theory, interactive activities that the student can learn, so that they're not just reading material and trying to absorb it and write it down in their own words. We have many activities for them. They can work the way down through each of the lessons and get to know Ben and his wife as they go through the journey. So really interactive, links out to really important resources that the student can then go on to use after they've finished this e-module, and then also apply that to their work, which is excellent. We do also have in the educator resource for this module the cultural section. So it really teaches the importance of cultural responsiveness with the inclusion of case studies. One is about a proud Yagara woman, and another one is about a Chinese gentleman, both who are having palliative care journeys as well. So that resource is there for educators. What I'll do now is I'll stop my share and I'll just go back to my slides so I can just pinpoint to you the key changes that have happened with 003. So the key changes for PAL 003 are performance criteria. If you haven't seen them, all the changes, or you may have, you'll be aware that there's an increased number of performance criteria that have been released in the new unit of competency. Our Care Worker Toolkit we've taken the time to ensure that we've mapped to those increase in performance criteria so that educators can see where our content aligns to that really beautifully. The largest increase has been in topic 4, which is end of life care strategy. So a lot more performance criteria around end of life care. Our knowledge evidence, there's a huge increase, I wouldn't say huge, but there's a significant increase in the amount of knowledge evidence that's part of the new unit of competency, and our toolkit has also been mapped to reflect where it aligns there. The other changes you can see, and I'll just break these down, this is probably more of interest, that there's been a big change in terminology. So the use of the word care plan is no longer part of the unit of competency. It's been changed to the terminology individual plans. So you'll see that's across all of our information now. The word care plan has really been removed. There's a lot more support about making the person an individual at the centre of the care. So if the patient has family members who they deem, or friends who they deem as supportive, it's not necessarily carers who are limited to the term significant others. So it's whoever the person sees as most important to them. Advanced directives has been relabeled, or the terminology has changed to advanced care directives. So that's all been updated. There's a lot more focus on the scope of the care worker within the document, and the use of the word scope in relation to the work role. There's a lot more emphasis, as I mentioned, on scope over the role. So they like to use the word, or they've embedded the word scope a lot more than role, so that we're really thinking about helping care workers stay within scope when we're teaching. Previously, when we were teaching about medication concerns, the teaching was geared at getting the care worker to discuss if they had misconceptions about medication care management. Now the focus tends to be on really focusing on the word concern. So if the care worker has a concern about something they're seeing with medication management, it's about how do they escalate that concern, not a misconception. And my understanding of that was probably just to take out the interpretation of the word misconception and really focus on the word concern. If you have a gut concern, then you're going to tell somebody about that. Any discussion on euthanasia has been removed from our content, and we now have our legislative links and information that's linked to voluntary assisted dying. And also, finally, we've updated to reflect the national palliative care standards for all professionals, all health professionals, I should say, and aged care services. So quite a few changes, and that document is available very soon. All the SCORM packages are available, and we'll have our hard print copies for this available soon.
Okay, well, I'll now move on to talk about 2 of our other resources for vet sector programs. And both of these resources have been developed in partnership with the IPEPA project, which is the Indigenous Program of Experience in the Palliative Approach. So in our Education and Training Collaborative here at QUT, we have PCC4U and PEPA and IPEPA all in one centre. And we are, I think Kylie said before, we're nationally funded palliative care projects. So the Australian government funds our work, and that's why we can provide all these resources to you for no cost, which is exciting. So the two resources that I'm going to talk about next are our focus topic 2 toolkit, which we developed for the students in the university sector, is really targeted to help non-Indigenous healthcare providers understand the cultural responsiveness with a palliative care lens for Aboriginal and Torres Strait Islander peoples. And we've been able to use the content of our university sector resource and pull it into a resource that we can align to Div 002, which I know is in some of the courses that you're teaching as well. Before I go into Div 002, I just wanted to show you a short video from our IPEPA project, which helps to kind of set the scene for some of these resources.
When someone has a sickness that can't be cured, we call that a serious illness or a life-limiting illness, or in other words, you're in the gunner. Now, many of you might think doom and gloom with this sort of sad news, but it don't have to be. Palliative care is holistic care. And no, I don't mean that whole, I mean the whole of us, our mind, our body, our spirit. All these things together are holistic. Holistic palliative care is designed around you and your family to provide a good quality of life if you have a serious illness. Like, for example, you might get joy out of humbugging your kids or painting or yarning with family and friends, and this type of care helps you to keep doing all of those things. Whatever quality of life looks like for you, palliative care aims to support it. Many people think that palliative care is just for those with cancer. The big C. And I'm not talking about drowning in the Billy Ocean here, no, because it's more than just that. Palliative care is for anyone with a serious illness, even young mob, because bad sickness can happen to anyone. Did you know that the main type of serious illness for our mob are heart disease, diabetes, respiratory disease, and cancer-related illnesses? Cancer-related? I mean, who wants to be related to cancer? That's not my mob. Palliative care is helpful all the time during a person's journey, whether they have weeks, months, or years of humbugging left. While the illness can't be healed, palliative care can provide healing in more meaningful ways. Yarning about death and dying is important for our mob, so we know more about it, and we can take control of it and not be frightened. Let's talk about before we walk about to the other side.
We've just titled it the Cultural Safety Toolkit, and we know that this unit of competency actually does come into quite a number of health-related training courses, so it may be useful in a variety of courses as well. So what we've done is really taken the content from our Focus Topic 2 toolkit, which was developed in partnership with community, and we've really translated that into 3 separate modules. And even though the unit of competency is structured a little bit differently to how we've structured this, we have, I guess, stayed true to the method and the series and the flow that community told us was important when delivering this kind of education. So we've divided it into 3 different modules. Module 1 is about me and my workplace. Module 2 is about Aboriginal and Torres Strait Islander health and wellbeing. I guess some of the areas of culture and ideas around health and wellbeing that influence how people access care and experience care as well. And module 3 is around providing care through engagement and partnerships. So even though this unit is probably more generic, we have content that layers palliative care into this. So I guess that's something to think about when you're going through it, that really we are looking at this content with a palliative care lens. But we have found with a lot of other educators who are using this to teach cultural responsive care, that the palliative care lens really adds to that, because I guess that's, I guess, a time where it's, you know, it's even more important that people are taking this inclusive and culturally responsive approach. So you'll find the different modules here for students. I won't go into the SCORM packages again to risk not sharing the right thing. This is actually just fresh on the, I'm going to say on the market, but we're not selling. So, you know, it's fresh out this week. So you are the first people to have a look at this. We've included the student modules here, and we also have still working on this in the background, an educator tile. So we'll have all the modules in one, with some additional educator resources and the mapping document as well, so we can show where it maps into the unit of competency. So I think that's probably all with that, unless people have questions. Anyone want to ask questions about this?
Sharon, there's a question in the chat around access to this.
Okay, great. I can't see the chat at the moment.
Just around it's not allowing self-enrollment, but I think you have got those settings open, haven't you?
We should have, yes, but we'll just double check that.
Double check, yeah.
So we'll pop the link direct to the course in the chat, and then after the webinar, we'll make sure we check the enrollment and pop you in there. Or we can actually just enroll you as well.
Yeah.
Was that everyone wants to be in there?
Renee was just asking, and I just said,
Renee,
I will definitely look into it in a moment.
Yeah. Yeah. So
me too, please.
Excellent. We might just, if you've all got accounts on our system already, then we can find you and just enroll you if you're not already, save you the trouble. So yeah, I think this will be really interesting to see how it works in practice. Part of the process we did in transitioning it into the vet sector, we did have peer review with a group of vet sector educators who all gave us feedback on, I guess, the application of this, how they would use it, and some of the mapping information as well. So that's all, yeah, I think that process has really helped to guide our approach to this as well. So, well, would it be suitable for non-nursing care students? Yeah, absolutely. I think we just had a little, dipped our toes into where this unit is embedded, and it's in a lot of training courses for different health workers. So right from dental assistants through to ambulance call officers, there's a lot of scope for that this is included in. So it's written in a very generic way, generic as in for anyone in healthcare. Good. Well, I'll move on and tell you about our last resource. And for some of you, this may not actually be relevant, but we've thought we'll tell you about it, and you might know someone who it's helpful for. So this is another new resource that we've put together, which is to teach into, I'm just going to find it and then I'll talk about it. So one of the key deliverables for PCC for you is to develop training resources to teach into packages that are preparing Aboriginal and Torres Strait Islander health workers and practitioners. So we've actually, again, developed this in collaboration with our IPEPA partners, and that includes a whole IPEPA community engagement group. And they really have helped inform the approach to this content and how we've developed it. So I don't know if any of you are familiar with the training packages preparing Aboriginal and Torres Strait Islander health workers, but there's many and varied units of competency. The same unit as we have for the Care Worker Toolkit, PAL 003, is one of the an elective unit that people can do, but that's not offered by many RTOs at the moment. So the approach we've taken with this is really to map the content directly to a whole range of units of competency. So we've written the content pretty much with the guidance of community, again, as to what they need to know, what they believe that people need to know who are going to take on these roles. And then we've mapped it backwards, if you like. So the mapping document for this is a bit of a monster, because there's about 12 different units of competency that this links into, and some of them are core and some of them are electives. So that's something we're working with NATSIWIP, which is the professional body for Aboriginal and Torres Strait Islander health workers and practitioners, and also NACCHO, the Aboriginal Community Controlled Health Organisation. So we're working with both of those groups who have RTO educator networks to develop the mapping and to see how they'll actually use it. So just a quick overview. I won't again go into detail. Hopefully you can enroll in this if you wanted to as well. Might check the settings. So module one. Fine. Oh, good. Thanks, Renee. We'll get you testing our courses for us. So understanding palliative care. So we're helping people understand what palliative care is, what are the key principles and who needs it. We take a rights-based approach to providing palliative care, and awareness of the role of the health worker practitioner in providing care. And then you can just follow your little footprints around. We look at communication, and yarning about palliative care, how that can be personally challenging, and how people might develop confidence in yarning about these kinds of topics. And then we look at it using a shared decision-making model to approach yarns about palliative care and advanced care planning as well. Symptom management, we don't especially focus on how to manage symptoms, but really just understanding the approaches that are used, and then how do they support families and individuals who are managing symptoms. And we, in the symptom management, we bring in a lot of the resources from the Caring at Home Toolkit as well, toolbox. Module 4, loss, grief and healing. This was really one of the key parts of the IPEPA education that we've leaned on heavily. And the content for this was developed in partnership with Seasons for Healing, which is an extension of the MacKillop Foundation, the Good Grief group, who have developed content specifically for this cultural context. And then finally, just the looking after yourself is module 5. So understanding how important it is to practice self-care and to develop those practices. And in that module, we're really looking at some of the Indigenous ways of caring for self as well.
So if there's not any more questions, just our take-home messages today, really remembering, and we've talked about this a lot, that all our resources are free. They're developed to support all types of learners, which is so important, and all our courses are aligned to the unit of competency, and the mapping is provided for all courses. And we're here to support. PCC for You is here to support you if you have any questions regarding implementation. No questions too big or small. We're happy to do one-on-ones with you if you need, or direct you to exactly where you might need to find something. So please reach out at any time. So thank you so much for joining us. What we'll do now is we have a short poll that we just like to share with people who've joined us today, just to get a little bit more information about how you felt the webinar helped you. Please, we look forward to having you at our next PCC for You webinar, which is on the 19th of April. I almost said the 28th of March, 19th of April. And that is all about palliative care education for paramedics. Lots of exciting work happening in that space that Sharon's been doing. And we did a little webinar on this last year, but we've got some development of some new content and some just looking at the PCC for You resources that we have for paramedics. So we hope to see you there. Always a popular one. So please join us then.